was your weekend?
It was good.
Not bad. Just rested right now.
Are you coming on my phone or you want home?
I'll go home.
Hey girls.
Hey, what's up?
How are you?
Good. What's on that face?
This doesn't look right to me. I don't know what it is.
Isn't he a patient with CF?
Yeah, good.
And he has no mask on?
Right.
And who is that with him? Is that a student?
Yeah, she's doing that. She was here this morning. Yeah, so check that out.
That's weird. Yeah, she should definitely have one. Who's that? Who's that?
Oh, it's like 18. You know what, honey? Can we get 18 because I think it's be better.
Sure.
Thank you.
High five, honey. What can I get for you?
Let's give her a card.
I'm hungry. When's my food ready?
So,
I'll check on that.
And this is
Well,
we have CB.
All right, let me look real quick at this.
Yeah.
Doesn't look
Yeah,
infiltrated or
I'm
anything.
giving you
Is
a
this
report.
one? No. Maybe it's just a tape. I'll go grab
So
some more
CB
tape.
18 year old treatment.
Okay.
We have
Everyone. I don't know the answer to this. Oh well. Here's your lunch, cutie.
thank you.
Let's see. Do you have a tray to put your drink on?
That's okay, I'll take mine one.
Okay. I'll take that. Let's see your ID one more time. Yeah, it's a little red, but I think it's just from the tape, so I think you'll be fine.
Okay.
So call me again if you need anything.
Okay.
Come in.
Hey, Angie.
Hi, Antoinette. How are you?
I'm good, but I need to share something with you.
Okay. Have a seat.
Okay. So, I'm walking on shift to get a report from Liz, and I see something, weird, and I see the nursing student with CB,
Which nursing student?
the nursing student from Regis.
Okay.
I see her with CB in the front of the nursing station, and she's playing with him, and he doesn't have on a mask or anything. And then 18's call light goes off, and she doesn't follow contact precautions, doesn't do hand hygiene, and she went in there with food. So, I just thought that I should report that to you because that's not hospital protocol at all.
I agree.
Yeah.
I will definitely have a talk with the nursing student
Absolutely.
as well as her instructor. I will try to see what's going on, make sure that she's aware that she's supposed to have protective equipment on when she enters a patient's room that's on precautions, and I will look into it.
Okay,
Thank you so
great.
much for coming to me.
Well, absolutely, care for the patients.
Have a good day.
Thank you, you too.
Thank you all for coming. I know it's short notice, but I thought this topic was very important. 2 weeks ago, there was an incident on our floor where one of our CF patients that had VRE were in a common area. He was playing in the nurse's station with one of our nursing students, and then the call light went off, and this nursing student went to another CF patient's room, and she did not use proper PPE equipment. Now, this patient, the other CF patient, was readmitted a couple of days ago with signs and symptoms of VRE. So this is why I brought all of you here to just show you why it's important that we need to use proper PPE equipment at all times. Sometimes we feel like we're rushed and we're just trying to get where we need to get, but we need to take the time and use proper equipment. So I brought in the nurse educator, Sarah. She's going to demonstrate how to use proper equipment and also the contact precautions, what you should wear. We all know it should be a gown and gloves, and she'll demonstrate how to put those on properly.
Great.
So first and foremost, what's really important is just to make sure you look outside the patient's rooms for a sign and know specifically what signs are what. So the example that we're going to use is the contact precaution sign. So make sure you see the sign outside the door and just make sure you're aware of it and know which patients are contact and which ones aren't. So the first thing you obviously want to do is do hand hygiene, use the pumps and wash your hands. You're next going to be putting your gown on. So make sure your gown is covering all parts of your body. I know sometimes a lot of nurses don't want to tie it in the back, but tying this back is very important because you don't want this falling off when you're giving a patient care in the room. So once you have that tied on, you're then going to put your gloves on. And make sure your gloves come all the way up over your PPE, and then you are safe to go into the room. So then afterwards, when you come out of the room, you're going to be removing your gloves properly, dispose of them in a safe vicinity, and then take off without trying to get any of the dirt or soil part of your gown touching all of your clean portion of your body. Dispose of this properly, and then again, do hand hygiene. So, thank you so much.
Thank you.
Any questions?
No.
Thank you all for coming.
Thank you.
We look forward to not having any more of these incidents, and keep up the good work.
Thank you.
Thank you.
Hey, bud, what are you doing? You gotta stay in your room. I don't have cautions. We have purpose. I know. You have to stay in your room. I'll come play with you later. Okay? Hey, how are ya? You're doing fine. Well, watch TV.
It's pretty good. That's pretty good. Not too bad.
How was yours?
Not too bad. Pretty good. Now, slept basically.
Really good.
Oh, what number was that?
Oh, it's 18. Taylor, can you do 18B first?
Yeah, let me just see what you want real quick.
Thank you.
Oh, you rang the call bell?
Yeah. I'm hungry. Is my food almost ready?
Oh, I'll check on that for you. Is there anything else?
Yeah, this right here is bothering me.
Let me take a quick peek.
Take it out.
I can't take it out, but does this hurt?
No.
It's not that red and it doesn't look infiltrated, so it might just be the tape bugging you. I'll get some new tape and we'll redo it and hopefully it won't hurt anymore. So just check and see if your lunch is here?
Yes, please.
Okay, anything else?
No.
All right, perfect. I'll come back with your lunch.
Good job, Taylor. I see you're using the proper PPE equipment. Keep up the good work.
Thank you.